I've been asked to talk to how PREA and BPCA works and how its effectiveness can help you to better understand the Orphan Act. I was a trial lawyer for 40 years before I retired in 2008 to form the Max Cure Foundation, which is a pediatric cancer foundation. The missions of that is to fund research, family assistance, and advocacy. I have been defined over the last few years in two respects. Number one, my foundation and I have been credited by many for obtaining the experimental drug for Josh Hardy, which ultimately cured his adenovirus and at the same time saved 89 other patients who would otherwise have died if they were not given the drug brincidofovir. When Ken Mock, who was the president of the drug company, gave the drug, he was thereafter fired, and when asked as to what distinguished the Josh Hardy matter from the over 300 other matters that he turned the drug down, he identified my foundation and me. The other thing that defines myself, which I've learned 3 months ago when I received a call from a banker who said to me, how do you feel about the fact that you're responsible for Donald Trump to become president? I said I wasn't aware of that. In the mid-1990s, I represented Mr. Trump, and I obtained a judgment for which he received several millions of dollars, and I was told by the banker that that judgment allowed him to work out his indebtedness with various banks, and so I have that. But in any event, I define myself as the grandfather of Max. Max was diagnosed with cancer in 2007. He had a cancer that Memorial Sloan told us they had never seen before. So talk about rare diseases. Of the 15,780 children diagnosed each year with cancer, which in and of itself is a rare disease. My grandson, his cancer was not seen by Memorial Sloan. He was 4 years old. He's now 14. He's a 10-year survivor. I'm told last week he had his first date, which was terrific. And I have learned in anticipation of today that of the drugs that Max was given, which ultimately cured his cancer, 50% were off-label and 50% were for pediatric indications. BPCA was passed by the legislature in 2002, PREA in 2003. They were each made permanent in 2012. There's significant progress made as a result of the passage of these laws as to the terms of numbers, timeframes, and successful completion of studies of drugs in the pediatric population. BPCA is considered the carrot. It's generally voluntary, and see, as a trial lawyer, it's told I have 6 minutes. All right, let me move forward. I'm sorry. All right. Since 1997, one of the great successes as a result of BPCA and PREA is that over 600 labeling changes have been made that, in effect, and it doesn't necessarily mean they're successful, but over 600 labeling changes have been made labeling drugs for use in children. Some will indicate that the results were not positive, others will indicate it was positive. So that currently this 50%, it was 80% prior to 1997, 80% of drugs used for children were off-label. Only 20% were on-label. As a result of BPCA and PREA, it's now 50% for off-label and 50% for label. BPCA provides the incentive for drug companies to develop drugs for children. It extends by 6 months from the 20-year patent period, whether it's successful or not successful, but as long as the study was completed. The OPEN Act is an extension of BPCA for rare diseases in adults, and like the pediatric indications, they do not have adequate clinical trials. Under PREA, which is called a STIC, the FDA has the authority to require companies to undertake certain studies for children without any reward or incentive. It excludes any drugs for an indication for which orphan designation has been granted. Basically, with respect to the OPEN Act, up to this point in time, I have been an advocate for pediatric cancer. I'm very much in support of Race for Children Act, which hopefully will fill a loophole under PREA. However, as a result of what I've learned in anticipation of today, I intend to advocate for the OPEN Act. And for those of you who do not support President Trump, perhaps I'm doing it for a little bit of penance to make up for what I was told by the banker a few months back. Thank you.